Essential workers, they're medical professionals, farm workers, postal workers, chefs, bus drivers, meat plant workers, janitors, and more. And immigrants make up a large share of this at-risk workforce. Yet for those who don't speak English, receiving accurate information about the virus and the government's response can be especially challenging. Harvard medical student Pooja Chandrasekhar started the COVID-19 Health Literacy Project.
The lack of access to information in one's own native language actually places these non-English speakers at a higher risk of infection.
Chandrasekhar lives in the Boston area, where she noticed some mobile clinics only had coronavirus handouts in English.
They would have a lot of folks coming to them concerned about potentially having COVID-19, but they wouldn't be able to give their English fact sheets.
In response, she enlisted a group of 175 medical students nationwide to translate coronavirus fact sheets in 37 languages.
The response has been tremendous, really beyond anything that I could have expected. They've been included on some of the largest health organizations' websites. Physical copies have been distributed to patients.
Like Chandrasekhar, a news anchor in Omaha, Nebraska, noticed that local immigrants were not receiving critical information such as park closures and social distancing guidelines. So she started recording daily TV updates in Spanish.
Todos ganamos cuando tú practicas el distanciamiento social.
There's some people who have been like, why are you guys doing this? They should know English. The reality is that the United States is just so diverse.
Democratic Congressman Jesus Shui Garcia is also taking up the issue. He is asking the White House to distribute COVID-19 federal response information in other languages than English.
They need to be reached as soon as possible for a successful public health response.
The White House told Newsy that it's working closely with Univision and Telemundo to have Dr. Anthony Fauci and other coronavirus task force leaders appear regularly on both networks to inform the Hispanic community. Some federal agencies and local governments provide guidance in other languages than English. But because Latinos and other immigrant groups are disproportionately hit by the virus, private citizens are working around the clock to close the gap. Ben Chamiso, Newsy, Chicago.